of infectious folliculitis, we will talk about the folliculitis. There is a broad classification. There is infectious folliculitis, bacterial, fungal, viral folliculitis, infestation. And there is also actinic folliculitis within 24 hours after sun exposure. The bacterial folliculitis includes the staph folliculitis, which we will talk later, superficial and deep types, and Pseudomonas aeruginosa, hot tub folliculitis, gram-negative folliculitis at the site of acne vulgaris due to antibiotic treatment, and syphilitic folliculitis, acneiform. And the fungal folliculitis includes dermatophyte folliculitis, Asthenia capitis, Taenia barbae, and Majuki granuloma, and Pityrosporum folliculitis and Candida folliculitis. Viral folliculitis, herpes simplex virus folliculitis, follicular molluscum contagiosum, and itchy folliculitis of HIV infection. The infestation, decidiosis. And also there is the perforating folliculitis. And we said the xenophilic pustular folliculitis in HIV patients. This is a broad classification of infectious folliculitis: bacterial, fungal, viral infestation, and actinic folliculitis. Bacterial, staph folliculitis, superficial and deep, we'll talk later, and Pseudomonas aeruginosa folliculitis, hot tub folliculitis, gram-negative folliculitis at the site of acne vulgaris due to longitudinal long antibiotic treatment, and syphilitic folliculitis, acneiform, fungal folliculitis, dermatophyte, Pityrosporum folliculitis, and Candida, viral herpes simplex virus, molluscum contagiosum, and HIV infestation, Demodex infestation. And there is perforating folliculitis and eosinophilic folliculitis of pustular folliculitis, and we said that there is actinic folliculitis also. Now, as regarding folliculitis also, the folliculitis is inflammation of hair follicle caused by either infection, as we said, like staph, and or physical irritation or chemical irritation also. So the folliculitis, there is deep and superficial folliculitis. The bacterial, we will talk about deep and superficial folliculitis. The deep folliculitis in the lower portion of the hair follicle, and from the isthmus and to the lower erector pili and down, and for the superficial folliculitis from the infundibulum to the isthmus of the hair follicle. The deep folliculitis: boil, furuncle, acne keloidalis nuki, and psychosis barbae. For the superficial folliculitis, there is Burkhardt impetigo, pseudofolliculitis barbae, and acute acne necrotica varioliformis. So there is the deep folliculitis: boil, furuncle, and acne keloidalis nuki, psychosis barbae. Superficial folliculitis: Burkhardt impetigo, pseudofolliculitis barbae, and acne necrotica varioliformis. Superficial folliculitis. The superficial folliculitis has acute and chronic. The acute is follicular Burkhardt impetigo or osteofolliculitis, and the chronic is acne necrotica varioliformis and pseudofolliculitis barbae. This is the superficial folliculitis. The superficial folliculitis we will talk about is first the acute type. Okay, of course we said that the superficial folliculitis is confined to the ostium of hair follicles, either physical and chemical or infective. So here the first one is the acute form, acute or follicular or Burkhardt impetigo osteofolliculitis. It is infection of the follicular ostium with staph. The etiology: organisms Staph aureus. Predisposing factor may complicate itchy skin conditions or use of topical steroids. Clinical age mostly in children, especially in scalp and limb. The lesion is dome-shaped pustules at the orifice of hair follicle, with hair piercing its center. Very easy. Dome-shaped pustule at the orifice of hair follicles with the hair piercing its center, usually in the limbs or scalp. Healing with 7 to 10 days with no scarring, because it is superficial. And the treatment is topical and systemic antibiotic, and treatment of predisposing factors as itchy skin conditions. As we can see here, this is a picture of Burkhardt impetigo, and also another picture of Burkhardt impetigo. The second type is acne necrotica varioliformis. The acne necrotica varioliformis, it is a chronic follicular necrotizing process. Etiology: Staph aureus or Propionibacterium acnes. Predisposing factor: emotional stress. Clinical picture: recurrent small red follicular papules and pustules which undergo central necrosis and heal with small pitted scars. There is a type which is acne necrotica miliaris. It is a milder form occurring throughout the scalp without scarring, and it's due to its superficial location. So the acne necrotica varioliformis, it is only a papules or pustules on frontal hairline, and it leaves pitted scars. It's either due to Staph aureus, as the rest of our folliculitis, or sometimes also it is of Propionibacterium acnes cause. The pseudofolliculitis barbae. It, of course, this is the treatment of antibiotic, either tetracycline or if it is due to Propionibacterium acnes, or staph antibiotic if it is from staph. Pseudofolliculitis barbae. It is a foreign body reaction to the hair in growing hair into the skin, resulting in foreign body reaction, red papules and pustules. The etiology: microorganism is not responsible. The inflammation resulting from the sharp edges of the hair that curve backwards after emerging from the follicle and penetrate to the adjacent skin. It's more common in the curly hair, which become ingrown. And the clinical picture: papules and pustules irregularly scattered over the shaved area, especially the beard skin of the neck and over the jaw. The treatment is shaving too infrequent, maybe after 6 weeks. Or each 6 weeks, and we use topical combined steroid and antibiotic as Fusicord. Sometimes we use diode laser or and finish the hyperpigmentation with a little glycolic acid or something. So this is the pseudofolliculitis barbae. It's a foreign body reaction. Sterile pustules. See here a picture of pseudofolliculitis barbae. This is another picture of pseudofolliculitis barbae. Now we will talk about the deep folliculitis. The deep folliculitis, there is also acute forms, which are the furunculosis and the furuncle boil and carbuncle, and the superficial part, which is the psychosis barbae and acne choroidalis nuchae. Okay, first the acute part is the furunculosis or boils. Definition: it is acute deep folliculitis. So it is deep and it is acute. Acute deep folliculitis. Don't go to the trick. Acute deep folliculitis of a single hair follicle and with the surrounding skin. It is acute deep folliculitis of a single hair follicle with the surrounding skin. The etiology is the staph, as all we were talking about is staph. Predisposing factor: decreased body resistance in diabetes, nephritis, anemia, HIV. And itchy skin conditions: scabies, sweat rash, atopic dermatitis, and alcoholism. Boil begins as a small inflammatory nodules that develop into about the hair follicle and extend and penetrate deeper, deep-seated, and then become permanent necrotic center, boil rupture, post-discharge, more boils all around. So it is hard, tender, red follicular center nodule that become painful and fluctuant abscess, and then pus become discharge. And the site is hair-bearing sites as thigh, buttocks, and face, neck, and axilla. So the furunculosis is acute deep folliculitis of a single hair follicle with surrounding skin. Etiology is staph. Predisposing factors as itchy skin condition and low body resistance and alcoholism. And a clinical picture: it is a hard, tender, red folliculocentric nodule that becomes painful and fluctuant, and maybe a pus after that is discharged. And treatment is systemic and local antibiotic. So this is a furuncle. It is a chronic, it is acute acute deep folliculitis of a single hair follicle. Acute deep folliculitis, the one to the right, is a furuncle. The carbuncle is larger and more serious inflammatory reaction with a deeper base characteristically as externally painful lesion at the nape, extremely painful lesion at the nape of the neck, sometimes in the back and thigh. Etiology: the organism is staph. Clinical picture: the involved area first is red indurated, become multiple pustules on the surface, draining externally around multiple hair follicles. Lesions soon lesion develops yellow-gray irregular crater at the center, which heals slowly, leading to granulation and scarring. This is the definition, etiology, and clinical picture of the carbuncle. It is a larger and more inflammatory lesion with a deeper base characteristically with multiple hair follicles. It is multiple hair follicle, extremely painful on the nape of the neck especially, and back and the thigh. The etiology is staph, and it is first red indurated, then multiple pustules arise on the surface, then become giving yellow irregular crater, and then granulation tissue and scarring. This is the furuncle, the carbuncle. This is the carbuncle. Multiple draining and multiple openings. The psychosis Barbie and the acne keloidalis nuclei, they are deep folliculitis, psychosis Barbie or folliculitis Barbie. It is subacute or chronic staphylococcal infection involving beard, mustache, or any occurs in the men after puberty. The folliculitis decalcans is the same process involving the scalp. The etiology is staph aureus, and it is edematous red follicular papules or pustules centered on a hair. Usually remains discrete over the beard or upper lip, but may coalesce to form raised plaques studded with pustules. Differential diagnosis, of course, from pseudofolliculitis Barbie and tinea Barbie. Tinea Barbie is a Curian-like, and pseudofolliculitis Barbie mostly is papules, not pustules. So here, the psychosis Barbie, it is a chronic staphylococcal infection of the beard and mustache area. Treatment, of course, is systemic and topical antibiotics. Clinical picture: edematous red follicular papules and pustules centered on hair follicles, usually remain discrete and on the upper lip, butt, and beard, and may coalesce to form raised plaques studded with pustules. In lupoid psychosis, the follicles are destroyed by scoring. So the psychosis Barbie, we can see here, this is a picture of psychosis Barbie, which is a deep chronic folliculitis. And also here, this is another picture of psychosis Barbie. The second type of chronic deep folliculitis is acne keloidalis nuclei. The acne keloidalis nuclei, it is a chronic deep folliculitis with formation of keloid-like papules and plaques on the nape, occipital, scalp, and posterior neck in males after puberty. And etiology is unknown, maybe friction by collar, brushing hair, or autoimmune because it responds to steroid. The eruption occurs upon the back of the neck and form raised transverse band at the lower margin of the lower scalp. Here we give the treatment is intralesional steroid, and we can give topical steroid and with fusidic acid like Fusicort. We give here high dose of steroid to induce atrophy, 20 milligram to 40 milligram per milliliter of Kinacort injection intralesional. Here this is a picture of acne keloidalis nuclei. So the folliculitis in brief. The classification of infectious folliculitis, either bacterial folliculitis, fungal folliculitis, viral folliculitis, and infestation. Bacterial, Staph aureus, superficial and deep, we'll talk later. Pseudomonas aeruginosa, hot tub folliculitis, gram-negative folliculitis, and syphilitic folliculitis. Fungal dermatophytes, Tinea capitis, Barbie, and Majuki granuloma. Pityrisporum folliculitis, Candida folliculitis, and viral herpes simplex folliculitis, follicular mascum contagiosum, and itchy folliculitis of HIV, infestation, Demodex infestation, and perforating folliculitis and eosinophilic pustular folliculitis. Of course, there is also actinic folliculitis within 24 hours after exposure. And the folliculitis, as we said, is inflammation of hair follicle caused by either infection, usually staph, and physical irritation, chemical irritation. This is the figure of deep and superficial folliculitis. The boil, acute, and the acne keloidalis nuki and psychosis Barbie, chronic. This is the deep folliculitis. The superficial folliculitis, the acute is Burkhardt impetigo, and the chronic is pseudofolliculitis Barbie and acne necrotica varioliformis. Superficial folliculitis, the Burkhardt impetigo, and the acne necrotica varioliformis, and pseudofolliculitis Barbie. All are caused by staph treatment, anti-staph treatment, and clinically, as we said. The deep folliculitis is the acute forms is furunculosis, boil, which is acute deep folliculitis of a single hair follicle, and the carbuncle, which is acute deep folliculitis of multiple hair follicles, and also the chronic forms of deep folliculitis, which is the psychosis Barbie and acne keloidalis nuki. At the end, there is a quiz here. What is the bacterial disease that is treated with antifungal? It is the erythrasma. We treated by miconazole cream. And what is the viral disease that's treated by antifungal? The oral hairy leukoplakia. It is treated with itraconazole, and also others like podophyllin and alcohol, surgical excision, and cryo and laser.